4 o'clock, excuse me, call to order the Wednesday, July 15th meeting of the Board of Health. I assume everyone's had a chance to go over the agenda. If there are no additions or corrections, I'll entertain a motion to approve.
That we approve today's agenda.
I second.
Moved and supported. Is there any discussion? Hearing none, those in favor say aye.
Aye.
Opposed, same sign, motion carries. I also assume that everyone has had a chance to read the minutes of the previous meeting. If there are no additions or corrections, I'll entertain a motion to approve those meetings as submitted.
I move to approve the minutes from the previous meeting.
And I support that motion.
Moved and supported. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign, the motion carries. We will move to reports. Review of accounts payable report.
Good afternoon. Does anyone have any questions for me?
Well done. The questions of accounts payable. Hearing none, we will move down to,
Question,
I'm sorry.
sorry, about the beach monitoring water tests. So we monitor and we pay to monitor them? I
I
don't,
will pass this to Casey.
okay,
We get a grant.
okay.
So we monitor through the swim season, so generally May through the start of September every year. The two beaches at the state parks.
Okay.
So Hayes and Hudson,
Right.
we go out typically once a week unless we get high results, then we'll go back out to resample. But so far this year, knock on wood, everything's been within limits. So we go out once a week, we collect 3 samples and those are, I think, $20 a piece. So, but the grant covers the cost
Okay.
of all of that, of
Okay.
going out of the
You just have
samples.
to include it.
Yeah, we take it to the City of Adrian lab and then they bill us for it.
All right.
Further questions of accounts payable? Hearing none, we will move to the health officer's report.
Good afternoon. A few updates for our department. We will be at the county fair starting July 26th through the week. Dr. Chernin will be here next meeting. So that's August 19th. So he will be here and you can ask him whatever questions you would like. Respiratory illnesses throughout the county are very low. There has been no additional detection of avian influenza since March. The month of June, there has been no additional measles cases through the state of Michigan. We did have a positive rabies bat at the very end of June. And so I went back and looked at when our last positive one was, and it was 2023. And so normally we test anywhere from 20 to 35 animals annually. And this year to date, we have done 18, and 25, there was 33. And then in 23, there was 29. So it's been pretty consistent. As of July 1st, MDHHS throughout the state, there is 19 bats that have tested positive and 1 skunk, and that covers 14 counties. There is an air quality alert for today and tomorrow. Those that have lung or heart disease in adults over 60, and also those that are pregnant and children are recommended to limit outdoor activities due to the fire in Canada the smoke is making its way down. Natalie is going to discuss some communicable diseases that we've been dealing with, and if there's any questions on what I reported, I would be happy to answer them.
Questions for the health officer's report?
I just have a question. With the rabies bat, was there anyone that had to have shots because of the bat?
Yes.
Further questions, comments? Very good. Hearing none. We have no business or existing business. Is there any old business? Very good. Go to new business. Program reports, more health, 3 personal health.
So we've been very busy in communicable disease as always. As everybody sees in the news, the Cyclosporus outbreak is pretty much started in Lenawee and is now moving up the east side to Wayne, Oakland, Grand Rapids, Kent County, all of that. Just a little bit of back information. The Cyclospora parasite is a little tiny microscopic organism that you eat off of your vegetables. You drink in water. It comes from human feces. It can be in the water that you water your vegetables with, your fruit with. We had a meeting today. There's still no identified source. There's hearsay of the identified sources, but we have not gotten any confirmation on where this is originated from. So a little bit of back information for the county and for the state. I did a 5-year history of this disease. From 21 to 25, the state only had 234 cases. As of today, we are at 3,726 cases for the whole state. Now, at county level, for those past 5 years, we had 3 cases, which the 3 cases, you know, is like a big deal. We're at 161 as of today. So as you can imagine, we're a little bit overwhelmed, but this is nothing unfamiliar compared to what we dealt with COVID. So we do what we can. The average age is from 9 to 87 years old, with the largest group being 30 to 39-year-olds, which is about 41% of our patients. The average day of onset is 7 days, but it can take anywhere from 2 days to 2 weeks for it gets into your small intestines. And that's where it starts, the infection and of course the diarrhea, everything that you've been hearing all over the news. It is very common for this parasite you can act like you feel better and then 2 days later, you're right back at it. People lose an extreme amount of weight, dehydration. I believe in the state there is 14 people hospitalized. So every Thursday on MDHHS's website, they update the numbers for county level and state level and the hospitalized. So if anybody has any questions, you can either email me and I can get you the information, send you the link, or all that information is available.
And what is your role in all this? What are you doing? Are you testing people or?
We can test people. We don't have the capacity right this second to test people. Our role is we interview every single person that comes through. So on average, the interview takes between an hour to an hour and a half of all the questions. So with the help of Monica, we have implemented and learning from COVID, people respond better to text. So we developed, there's a supplemental questionnaire besides the state database that we have to fill out. So we implemented a texting system that's HIPAA compliant, that we're able to send this information through.
So how do you find out about them? How do you?
It comes into, so there's a state database that
Okay.
it's, all the surveillance, anything that is a reportable disease comes into the state database by law.
Okay.
So all these cases come in there, and so every day,
You
over
get
the
all-
weekend, it's like,
So anyone in Lenawee County, you get that information. and-
yep, we get all of that information.
Do most people that are sick willingly participate and try to find out where this came from? In your interview?
I would say about 25 to 30% of people. Some not so willingly, but they still participate.
Okay.
But yeah, I would say about maybe 25 to 30% of the people will respond. Especially if it's a bigger outbreak, they tend to be more cooperative than it's just a small individual case.
Okay.
And we have found that using the form and texting has had great results because they can do it on their own time and not sit on the phone for an hour. So we've had good success with that.
For questions. I want to just clarify something. When you started, you said this infection, bacteria, whatever, is on vegetables, fruits, and you went through. Is that normally on there, or is that's the result of the problem?
That's the result of a contaminated either water, crop, soil. Yeah, they haven't identified it yet. No, it is not normal because it comes from human feces.
Right.
So wherever this contamination originated from is somehow spreading. So
Very good. Thank you. Further questions, comments? Hearing none, we will move to environmental health.
Alrighty, so you have your packet with all of your normal info about well and septic and food service. Nothing too exciting on either of those reports. We have seemed to be over the last month or so getting a lot of plan reviews. Some of my staff are doubled up, which isn't normal. I would say typical, but they're getting them done as they can, as they come in. A lot of food trucks, and we've had several other places that were closed are reopening. I think I saw today before I left, the Weston Bar has a new owner, and she was approved, I think, today. I'm not sure when she plans to open, which is good. We always like to see places that have been closed get taken over and reopened. So we are just pushing forward with like our vector program and our beach monitoring. We did see a little bit of a spike in the bacteria at both beaches after 4th of July, which is not unusual. They get a lot of heavy use over the holiday. Neither of them had results that were above state limits, so we didn't issue any advisories. And then we've since resampled and the numbers have come back down into a more normal range. So it's just, I think, the heavy use and that we tend to see that on there's an online database, and I kind of snooped around on there, and there were many other beaches that also had higher than normal results following that. And plus a lot of rain, significant rainfall will also, with a lot of runoff, will increase the E. coli numbers. So and then just like Natalie said, we've just been sitting on the calls for the cyclosporiasis. One of the things that I wanted to point out with that, because we get that we've had a lot of questions on our end about it, is since they haven't found a source yet, why? And it's because the incubation period is so long for that, asking people to remember what they've eaten 2 weeks ago, even a week ago, is very difficult. We have that same problem when we have smaller foodborne illness complaints that come to us. It's very typical trying to get people to remember even what they had 3 days ago is difficult. So we've gotten a lot of questions down on our end. We're just kind of waiting to see, like Natalie mentioned, where it's coming from and going from there.
Can you pull bagged lettuce from the shelves in the grocery stores and see if there's anything in that, or is anybody doing that?
So MDARD has gone out based on those interviews. That's why they're so important, is because they then will use that information to kind of try to pinpoint areas to look and to take food and to test it. So they've been in the process of that. They haven't found like a smoking gun or anything as of yet, but they told us today there were a couple of things that they were looking at and that they'd submitted for testing. So that's why it's all many of the press releases at this point have been, we think it's this, but they don't have any definitive results yet. So
I heard Taco Bell, but.
that's been one that's been put out there. So yeah, once there's something definitive, trust me, it'll be out there, I'm sure. So other than that, and we are hiring for a program secretary. If anybody has anybody who might be interested, it's on the website. So other than that, I don't think I have anything.
Further questions? People rattle these names off. Cyclosporiasis. Took me 12 times to even get it close to right.
It took me a few tries to even pronounce it correctly, so I'm giving myself props for that.
Okay, no questions, comments? Hear it down, we'll go to emergency preparedness.
Emergency preparedness, the new budget period started July 1, so that is a brand new work plan that we are working our way through. All the year end has been submitted and it's business as normal.
Questions, comments? Very good, hearing none. Finance.
Hello again. So our state budgets are being entered right now. They go through a slight process. It'll probably take over the next month to finalize those. The county budget figures are due within the next few weeks. So that's moving along quite well as well. And then in your packet, I have our pricing updates for the immunizations. For the most part, the majority of them remain the same. We do notice that quite a few of the more seasonal, like the RSVs, have come down in price, and that's pretty standard because it's out of season, so it's more of a a lower price to get people to pre-order for the fall. But other than that, it's actually not too much going on as far as those price updates this quarter. So does anyone have any questions for me?
Question or comments? Very good. Hearing none. For immunization pricing updates. Does somebody want to address that or what's on the sheet? Okay,
Sorry, that was just me. I just concluded in my,
very good.
I rolled it all into one.
Okay, do we have any public comment, ladies? No public comment? Any committee comments? Hearing none, I will entertain a motion to adjourn.
You have a motion to adjourn this meeting.
It's moved and supported. Is there any discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign.